Have you ever wondered about medical procedures, especially those that sound a bit involved? It is completely natural to feel curious, perhaps even a little concerned, about where a doctor might need to access something as vital as bone marrow. No, the hip is not the only place for a bone marrow biopsy, though it is certainly the most common and often preferred site. While the posterior iliac crest, which is the back part of your hip bone, is indeed where most bone marrow biopsies are performed, other locations can sometimes be used depending on individual circumstances. The primary reason the hip is so frequently chosen for a bone marrow biopsy is its combination of safety, accessibility, and the quality of the marrow it holds. The posterior iliac crest is a large, flat bone that is close to the skin's surface, making it relatively easy for doctors to access with minimal risk to nearby organs or blood vessels. This area also contains a rich supply of active bone marrow, which is crucial for obtaining a comprehensive sample for diagnostic purposes. For adults, the sternum or breastbone might be considered in very specific situations, especially if access to the hip is not feasible. In infants, the tibia or shin bone can sometimes be used because their bone marrow distribution is different. When preparing for a bone marrow biopsy, understanding the procedure can help ease any worries. Your doctor will typically explain why they have chosen a particular site and what you can expect before, during, and after the biopsy. Do not hesitate to ask questions about the exact location, the type of anesthesia that will be used, and how to manage any discomfort. You will usually lie on your stomach or side, and the area will be numbed before the sample is taken. Remember, open communication with your healthcare team is your best ally in this process. It is also interesting to know that a bone marrow procedure often involves two parts, an aspiration and a biopsy. The aspiration collects a liquid sample of the marrow, while the biopsy takes a small, solid piece of the bone marrow itself. Both samples provide different but complementary information to help doctors diagnose conditions accurately. This dual approach ensures a thorough analysis, offering a detailed picture of your blood cell production and health. Understanding that the hip is the most common site, but not the only one, helps demystify the bone marrow biopsy procedure. This knowledge allows you to feel more informed and confident, knowing why your medical team makes certain decisions and what to anticipate. Ultimately, the goal is always to gather the best possible information to guide your health journey effectively and with your comfort in mind.